It's all in the story, and my personal story goes back to when I was 2.5, maybe 3 years old, visiting my grandfather in the hospital. He had just had gallbladder surgery. I'm visiting in the little visitation room, chalkboard. He wants to draw anything I want to draw, anything I want, he'll draw on the chalkboard. I wanted a sailboat. Beautiful sailboat. That's my most vivid childhood memory. It's also the last memory that I had of my grandfather. He died of a medical complication of gallbladder surgery. And as I grow older and I'm in the field of medicine, it seems like every family, every person has a story that has touched them. Either they've been affected by medical error, they have had a close call, or they've lost a family member due to a preventable medical error.
I joined the HRO movement and became a physician champion for a number of reasons. The main one being it's a way to enhance patient care, and that, I guess, is the focus more than anything, is ultimately getting good patient care and getting the optimal patient care. It has some secondary reasons. We have a residency program, and it becomes the way of training. You use it in training for the residents. You inculcate it early in training, and it becomes part of the DNA of a young physician as they move forward, and then you integrate it into the culture of the hospital and of the medical system.
It's important for me in my role, not only as a physician, but as a physician leader, to express to our other physicians that as part of the healthcare system, physicians are in a unique role because they really do engender the trust of the patients and their families. And it's really important for the physicians to be at the forefront of leadership in leading this cultural transformation towards high reliability and ultimate safety.
In the Chief Medical Officer role, pretty much what you have to do is be the champion of the patients, the associates and employees, and everyone else who's involved in the institution. And there are three things that I always think about when I talk about patients. What they want is, don't hurt me, make me better, and be nice to me. So the very first thing, which is the don't hurt me, is what we're all about when we talk about high reliability. And over the years, unfortunately, healthcare has not been as high reliability as many other organizations. And we always talk about Toyota and aircraft carriers and these kinds of things. And we've learned and started to learn from those industries that we can become much, much more reliable in terms of how we provide safe care to patients than we ever were. And I think that's probably a relatively new thing in terms of people believing we can do that. If you talk to some older doctors, my age, for example, they may say to you, you know, you have to accept a certain amount of complications and mortality. That's actually not true. And I think we're starting to learn using high reliability techniques that in fact, you don't have to accept bad results, you don't have to accept complications, you don't have to accept the things that happen to patients that are preventable.
The things that the organization is doing are things that we all believe in. We practice medicine, we take care of patients, we have patients' lives really in our hands every day, and so these are things that we believe in anyway. In our roles as leaders, it's our job to try to ingrain that in our practices every day. And so this is, for me, another tool to help me do my job in taking care of the patients on our unit and making that work well. But it's a bigger tool. It's something, like I said, it's what we all believe in. It's what we sort of do every day. And so to be able to formalize it and make sure that we're providing the best care for our patients who, when they're there in the hospital, they can't protect themselves. They rely on us to do it, and this is sort of the best tool to sort of get that process going.
But I recognized the HRO culture once I started getting my pilot's license. What I realized was that aviation was very similar to medicine. If you didn't follow protocol, you would cause a catastrophe. In the airline industry, you'd kill yourself, whereas in medicine, you'd kill a patient. That was the difference. So what prompted me to become an HRO physician was to follow the same principles in aviation to go through the checklists every single time to make sure I was safe. And if I was safe, the patient would be safe.